Hi, this is Liz, and I'm the dietitian for Acadiana Functional Nutrition Center, and I'm really excited that you're taking a few minutes out of your day to listen to how to read your blood chemistry report that you're more than likely getting in your annual visits with your primary care practitioner. I want to help you look at it from the perspective of what your blood parameters are trying to tell you ahead of time, ahead of disease progression, so that you can take a preventative role in your healthcare. So the first step will be for you to, of course, if you haven't already, to schedule an appointment with your primary care practitioner, and you'll want to be very specific regarding which parameters you would like for them to include. So typically they will include a blood chemistry profile, which will include your basic chemistry parameters, including a fasting glucose. But you do want to make sure that they are adding a lipid panel, and typically they do. But this would be a measure of your total cholesterol, your triglycerides, your LDL, as well as your HDL levels. But in addition to that, you want to request that they are adding an A1C, as well as a fasting insulin level. Now, if you're someone that is struggling perhaps with weight management, or you've been very fatigued, I would probably suggest that you also add a thyroid panel. And I always feel that it's a good idea for everyone in their annual visits to also measure their vitamin D levels. So those are two additional parameters that I think may be of an advantage to you to have as well. But let's go ahead and assume you have that report, or you're getting ready to get that done, and look at it from the perspective that I look at it from when they come to my office. I'm always looking at it from the perspective of your body's trying to tell you something. And so how can we change things in our diet and in our lifestyle to prevent onset, especially of things such as diabetes or cardiovascular health disease. So when you're looking first at your fasting glucose, this typically will range somewhere between 70 and 110 on the parameter. And unless yours is high or low, it's probably not going to have any sort of flag on it. But I want to encourage you to look at that from the perspective of what could my body be trying to tell me in advance. Again, so I don't like to see a fasting glucose level that is greater than 90. To me, this is one of the first warning signs that your body is trying to tell you that you're having a little bit of a difficult time clearing your blood glucose, and it could be one of the first warning signs that you are becoming what you may have heard people call pre-diabetic or insulin resistant. Another word would be possibly metabolic syndrome. So there are these little warning flags, and the glucose level is one of them. So anything greater than 90 is a possible warning flag that you would want to cross-check with other parameters. One of those things that you can cross-check that with would be, what was your A1C level? This is a measure of your glucose control over the last 3 months. It's really actually more accurate than your fasting glucose, because your fasting glucose is really a snapshot in time. It really just reflects what you looked like at the time that your blood was drawn. So you can actually have a very low, and I wouldn't say like flag low, but like in the 80s blood glucose, fasting glucose, but an A1C of 5.6 or 5.7. And I don't like to see A1Cs greater than 5.5. So the reason I like to have an A1C in addition to a fasting glucose is because it really is a more accurate measure of blood glucose control over time. And so so anything greater than 5.5 does suggest that, again, your body is having a difficult time clearing glucose. And if you're having symptoms that range from fatigue and abdominal weight gain, some of these things are going to actually start making more sense to you. Now, I do also like to see a fasting insulin level. This is something that's not commonly measured, but I'm hoping that we can see it measured more often. And I do encourage my patients to request it so that they can see what their insulin levels are doing. And more than likely, you're familiar with insulin from the perspective of its role in removing glucose from the blood and bringing it into the cell, which is where it's used for energy. And of course, it has many other roles as well in our body, but that's the one that we are most familiar with. Insulin levels will range on a chart of normal from 5 to 15. Uh, I, though, like to see my normal patients ranging from 4 to 7. So I'm a little bit more proactive because if you have too much insulin, insulin is also anabolic. So that means that it can be in large numbers, in large quantities, a reason why your body is possibly packing on a few more pounds, because when you have too much of it, it actually is a good way for you to store more fat, and that would be predominantly around the abdominal belly area and or in your lipids, and specifically your triglyceride levels. So it's a lipogenic in that it really does encourage the production of more fat, not only on your body, but in your blood as well. And the reason I like it is because it will more than likely show warning signs ahead of the fasting glucose and the A1C. So it's more likely to be elevated before you see maybe glucose levels greater than 90 or A1Cs greater than 5.5. So it's a really proactive way for you to be in charge of your health. Now, finally, I do like to cross-check all of that with the fasting triglyceride levels, because as I said earlier, more than likely, if your insulin levels are elevated greater than 7, approaching 10 and maybe 15 area, it's not unlikely to also see the triglyceride levels climbing, because as I said, insulin is anabolic and tends to promote the production of fat. So triglycerides greater than 100, especially if you're seeing elevated insulin levels, elevated glucose levels, and possibly even elevated A1C levels, is another indicator that your body is struggling to clear glucose and is starting to probably show physical symptoms of that as well, in the form of gaining weight, especially in that abdominal area, maybe a little bit of fatigue especially after you eat. You could really use a good nap. These are very, very common symptoms of what we call insulin resistance, or possibly prediabetes, metabolic syndrome. They're all pretty much the same thing. So if you're looking at your blood panel and you're seeing these red flags, what do you do about that? Well, obviously you're going to probably need to explore how you can change your diet. And if you're looking at me and thinking, gosh, I've done everything I can in my diet and I'm still not seeing the results that I thought that I would see at this point, then I would honestly suggest that it's probably time to schedule an appointment with a registered dietitian that can help you not look at just diet, but also contributing factors that could be possibly impacting these numbers as well. And of course, that's what we do best here at Acadiana Functional Nutrition Center. We'd love to help you. So if you're looking at your blood panels and you see these warning flags, go ahead and give us a call. We'd love to help you with reading that report and giving you a good nutritional assessment regarding how we can help you start making not only diet changes, but lifestyle changes, and addressing any underlying root causes that could also be contributing to that as well. I hope this was beneficial and educational, and I again thank you for taking time for listening. And should you have any questions, just give us a call. Thank you. Have a great day. Bye-bye.